Do you have pain throughout your body? Do you have pain across your shoulders into your lower back? Do you have migraine headaches? Do you have chronic fatigue? Do you have constipation? If you do have those conditions, you probably have a condition known as fibromyalgia. Hi, I'm Dr. Griffin. I'd like to talk to you a few minutes today about fibromyalgia, what causes it, and the treatments that we do that can help people. Now, I say you probably have fibromyalgia if you have those conditions, because here's the thing, there are no tests, there are no diagnostic tests, there are no blood tests, CAT scans, MRIs, X-rays that would actually tell the doctor if you have fibromyalgia. In fact, the only way that doctors diagnose it, if you will, is they do an examination, and in the examination they're looking for tender points throughout the body. Specifically, you need 13 out of 18 tender points, and then you have fibromyalgia, supposedly. So if you have 9 out of 18, you still got it. If you have 15, you still got it. That just is a criteria. So here's the thing about fibromyalgia. It's a debilitating disease. It affects over 15 million people in the United States alone, and yet nobody seems to know the actual cause of it. Here's the thing we do know about fibromyalgia. So far, the research points to some type of trauma to the central nervous system is what initiates it. That's what starts the ball rolling, if you will. So what we have found, and what other researchers have found, is that something happened in your life, whether it be some type of car accident, fall, overwhelming mental or physical stress. That was the initiating factor that causes fibromyalgia. So here's what happens with fibromyalgia. If I can show you on this, this is a small kind of a cutaway of the upper neck and the brain area. And as we all know, the brain controls everything. And what you probably don't know is this little area back here, this green area, that's the cerebellum. Now the important thing about the cerebellum is it controls all of the muscles of the body. Okay, it controls your posture. And the thing most people don't realize about fibromyalgia is that it's not really a muscle problem. Yes, your muscles hurt, they ache, but that's not the problem. The problem is really in the central nervous system. So here's what happens with fibromyalgia is that this trauma, this stress, what it does is it affects that back part of the brain stem, which controls the muscles, okay? Overwhelming stress from a fall, an accident, some type of trauma will cause the cerebellum to literally kind of short circuit, if you will. When it does that, the front part of the brain stem, called the mesencephalon, big word there, that causes it to overfire. Now here's what happens. That shoots down the spinal cord, okay, and through your nervous system, and it excites everything. So as one example, what happens is the adrenal gland, okay, that just releases stress hormones, and when that's overstimulated, it releases pain fibers, if you will, or it causes the pain fibers in the body to become very sensitive, very sensitive. So sometimes even the brush on a person with fibromyalgia is very excruciating and can become very chronic over time. So we do know that the central nervous system is always affected with people with fibromyalgia. And one thing we notice also is with people's posture with fibromyalgia, you may see a high shoulder, the hips twisted, and the head twisted. That posture is literally locked in. It's not supposed to do that, but because the cerebellum, again up here, has lost control over that, that alone causes the muscles to tighten up, okay, because of the trauma. And you actually have what's called lactic acid. That builds up in the muscles and becomes very painful. And that's how we identify these 13 out of the 18 tender points. So here's the thing. You can take medications, and frankly, I think there's been 3 or 4 of them in the last year that have come out specifically for fibromyalgia. And the people that we've come in contact with will tell you it takes the edge off a little bit, but it really does nothing about solving the problem of fibromyalgia. And that's what we do is different, is that we do neurological treatments, okay? Neurological treatments for one reason, to take the stress off the spine, to get the brain stem and the cerebellum firing properly again. So all our treatment is geared towards that end. And in fact, we see some pretty darn good results by taking a neurological approach rather than a drug approach. So there's a lot more information we would like to send you, and if you would fill out the form here, we'll be glad to send that to you. Also, you can call our office. We'll be glad to set you up for an appointment. You can come in and we'll do a consultation with you, an examination. And actually, to tell you the truth, I don't accept every patient. You have to qualify for the treatments we do. So if you come in, we examine you, and I don't find the things we're looking for, I'll refer you somewhere else. So you really need to qualify for the treatments we give. The ones who do qualify, we get pretty darn good results. So I know it's a debilitating disease. It can become heart-wrenching, but I'd like to offer you some hope for that. So if you would, fill out the form, email us back, or give us a call, and we'll see what we can do to get you feeling better. Thanks, and have a great day.